Welcome, everyone, to the Yoga Therapy Hour. Today, I'm going to be talking to Mercier, and wow, this is quite a story. Stay around for part one and part two. We take a little breather in the middle to talk about different types of yoga, and then part two is a very intense and vulnerable part of the story. So I don't want you to miss out on that. And, what this story with Marcia has shown me today is the strength of the human spirit, this ability to go deeply within and have trust in ourselves, trust in our family, trust in our community, trust in our dharma or the way that we serve in the world, trust in possibly something higher than yourself, that even though there are challenging things that happen in our lives, there's still life to be lived. And I think sometimes we're so exhausted that when something hard comes along or tragic comes along, we collapse. And we need to give permission for that too. But it is also so inspiring to hear someone like Marcia, and then part two is about her son, Alex. It's really beautiful to see the strength of the human spirit and how we can rise from what appears to be the ashes of tragedy. So let's get into this episode and go meet Marcia. Hello, everybody. Welcome to the Yoga Therapy Hour. This is Amy Wheeler, and I want to thank all the people who've come forward in 2025 to tell their stories. We are completely booked through the end of the year, so we will not be taking any more stories. In fact, many weeks I'm recording 2 every Thursday because so many people were willing to share of themselves, to be generous and gracious, to help other people to suffer less. It's been quite a year. We're so happy that we have another several months of stories to share on the Yoga Therapy Hour. But just to say that at this time, we're no longer needing people to volunteer. The response has been amazing. I feel overjoyed with so many of you willing to give of yourself to help others suffer less. We thank you. We're glad you're here. Let's go see our guest for today. Welcome, Marcia. So nice to have you with us today. Thank you for being here.
Thank you for inviting me, Amy. It's lovely to be here.
Marcia, where are you joining us from?
I'm joining from London, UK.
Oh, good.
So, yeah.
I like our listeners to be able to kind of imagine where you are. And I'm in the middle part of the United States near Minneapolis. So, all right. Well, I was so touched to read what you had wrote. We've gotten so many people willing to tell their stories of how yoga therapy, and Ayurveda had helped support them at very difficult points of their life. But I hesitate to start a podcast off with like the hard stuff. So I always like to start with what makes you joyful? What makes you happy? What makes you want to get up in the morning?
Oh, that's a really good first question. Oh, gosh. Just the day itself makes me joyful. Just waking up. My bedroom's at the front of the house. So in the morning, we open the curtains, and if it's a sunny day, we see the sun. The sun just streams through our bedroom window. So that's a really joyful start to the day. And even if it's a rainy day, it's fine. It's just another beautiful day, isn't it? I like to embrace all weather conditions each day as it comes. So that's the first thing that gives me joy. And absolutely, my family give me joy. I've now got 2 grandchildren, and there's just nothing like just being with the grandchildren and holding them close. It really gets all those feel-good hormones going, doesn't it? It's just amazing.
Is it different than when you held your own kids close? They always say being a grandparent is so great because you get all the good stuff, but you don't have to do so much of the hard stuff. Do you feel that way?
I think you've got more time to just appreciate that those moments when you're close. I mean, yes, it's lovely when you're a parent and you're hugging your child, but usually you've got a million other things going through your mind. But being a grandparent, you can just be completely present and just enjoy those special moments. And yeah, it's really lovely. Really grateful for that.
One more joyful thing can you think of?
Well, it has to be my yoga.
Okay, good. Tell us. How did you discover
It
yoga?
has to be the yoga. How did I start yoga? Well, it was back in 1998. I took my first yoga class. It was a result of having a cancer diagnosis. So I'll go a little bit into my cancer diagnosis and what brought me to yoga. So I was 32. I'd already had two of my children at the time. So I had two boys, aged 2 and 4, and completely out of the blue, found a small lump in my breast and didn't think anything of it. Thought I'm 32, there's nothing to worry about. Anyway, to cut a long story short, it ended up being cancerous. And I went through two lots of surgery, ended up having a mastectomy and reconstruction, and then hormone therapy to treat me. So, having sort of been through that diagnosis, surgery, the ongoing hormone treatment, having two little boys, and just thinking, I just want to be around to see them grow up. It was just a really anxious time for me.
Was that from you figuring out that there might be a problem to going through the surgeries and reconstruction and hormone? I mean, was that a year, 2 years?
No, I mean, everything sort of happened quite quickly. So I was diagnosed in May of 98, had one surgery then, had the mastectomy in June. And then after that, I started on tamoxifen and stayed on tamoxifen for 3 years. I was supposed to be on it for 5 years, but my oncologist let me come off it because I wanted to try to have another baby, which I did, and then had a little boy. So I was absolutely blessed to be able to have another child and after my breast cancer. And so it was a short space of time in terms of the diagnosis, the surgery, but then it's the recovery. You kind of hold yourself in check and get through whatever you need to get through to give yourself the best chance of survival. But then it was afterwards, it really, really hit me. And, you're supposed to be thinking, great, I can get on with the rest of my life now and just get back into my routine with the boys and everything. And it wasn't like that at all. I felt really, really tearful the whole time, on the verge of tears. And I'm normally a very patient, calm person. And I was really impatient with the children. So I just knew that I wasn't right. And I went off to see my GP. And the doctor said, oh, it sounds like you need some counselling. I can refer you to a counsellor. But I don't know, I just shied away from that. And I just said, oh, let me think about it. I'll think about it. But in the meantime, I just thought, I'm going to just take myself off and try some yoga. I mean, at that time in 1998, yoga was really kind of big in the media. There were well-known people practicing yoga, and I thought, oh yeah, I'll try a bit of that. So I went off and tried an Iyengar class at my local gym, and I really loved it. I was absolutely sort of drawn into it from that first class. And what I really liked about it was that it was very disciplined and precise. And because I was learning something completely new to me, I wanted to make sure that I was learning it correctly. And it was, we held the poses for a long time, and you had time to really sort of feel into the pose and the practice. So that for me was really good. And it reminded me a bit of my ballet classes that I used to do as a child. My teacher was really strict. So was the Iyengar yoga teacher. She even made the seams of my leggings go straight. So if they were a little bit twisted, I had to straighten them up. So it was like that. But, it didn't put me off. I loved it. And I went for two 90-minute classes a week while the children were at nursery. And that was my time to myself, out of the busy time of being a mother, trying to recover from the cancer diagnosis. That was time for me to just spend time looking after myself. And it actually became quite empowering because the stronger I became through my yoga practice physically, the stronger I felt mentally and emotionally. It was very asana based, the practice. There wasn't really much, I wasn't really getting much of anything else in that Iyengar class. But, what I was gaining physically, I was also gaining mentally as well. So that was the start of
There-
it.
There's so many interesting things I want to say. I hear this over and over this year as I'm talking to mostly women about their health diagnosis and how they came back. And I hear over and over that taking that twice a week, time for yourself to connect with yourself, to feel stable, to feel strong, to have someone else caring for your children during that time has been a game changer for so many women. And I feel like we should
Mm,
shout that from the mountaintops to all moms. Like, if you feel like you're
mm, yeah.
overwhelmed, find a gym, put the kids in the nursery. You can keep an eye over there and jump into these classes. So that I just want to tell people I've heard throughout almost every interview I've done is that happens and is so critical. But I also want to go back to something way back. What made you, after having a cancer diagnosis and you had two children, what made you think, I want to have a third child? Because I think when I was recovering, I was worried, is this going to come back? We don't even know what stage it is yet, because you don't know if it has spread. That first 3 years is that very delicate time where you're kind of like, "Ooh,
Mm,
it could come back, the chances are higher."
mm.
So, can you tell me about that? It seems so different than the mindset that I was in, which was kind of slow down, do less, get smaller. And here you're like, I want another baby.
So, to be clear, my breast cancer diagnosis was actually early stage cancer.
Yeah,
So, my chances of recurrence were quite small. And taking tamoxifen really helped to then reduce that risk.
yeah,
So, there was still a risk. And my oncologist really pointed that out to me. She said, there is still a risk that the cancer will come back and it might be exacerbated through the pregnancy because it was estrogen receptor positive. But I was just angry. I was just so angry with the cancer diagnosis. I just saw it as a huge interruption in my life.
mm,
And I didn't want it to stop me doing what I wanted to do with my life. So I really wanted to have a third baby. My husband was not so keen because he was being more cautious, and saying, well, we've really got to, be sensible about this and you being around is much more important. But we gave it time. So there was a 5 year gap between the cancer diagnosis and having the third child.
yeah.
And I was able to breastfeed him with just one breast, which was amazing. And yeah, it was a really positive experience for me to have that third child and made our family complete. So I just didn't want cancer to get in the way of what I wanted to do with
I,
life.
I love the attitude. And
You could say that that was a bit reckless, but
no, no,
I
I'm
just
not.
just
No, 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 I'm not. I hope that it didn't come across that way at
no,
all.
it doesn't. It doesn't. But I know people might think that was, but every cancer diagnosis is different. And I stress that my breast cancer was early stage cancer, even though I had to have a mastectomy because it was widespread. So in some situations, you just wouldn't even think about it.
And I just want to normalize that whatever experience we have during diagnosis, during treatment, afterwards, like everyone gets to decide that for themselves. And I think it does give us an opportunity to really look at what's important to us, what we want out of our lives and didn't quite accomplish yet or didn't get to experience yet. And then you just feel like, I have this one life. I need to go
Mm,
for what I want out of this life. So, for some people, that means, wow, I've been working too much. I need to quiet down and, you know, meditate more or go on hikes more. For other people, it's like, I want to start traveling or I want to have another child. And I want to normalize
mm,
that we all get to reflect on basically how we had been living our lives and what we want to expand once we have that reflection time.
yeah, that's important.
So let's go back to you started with Iyengar and you said that it made you feel strong. not just physically, as your physical strength grew, your mental, emotional strength, and maybe even your spiritual strength. I don't know if you have inclinations towards that, but tell me more about how that happens, because that's really fascinating. And I know women that are now opening weightlifting gyms for that reason.
Yeah, no, it is amazing when you're doing a physical practice, whether that is a physical yoga practice or whether it's an exercise class or strength training, and how that physical strength in your body can affect your mindset. There's a lot of research out there, isn't there, now that to say that certainly for cancer survivors to actually have that movement practice to help them deal with side effects of cancer treatments and reduce recurrence risk and all of that. So I didn't know all of this at the time. I was just feeling whatever I felt in my body and thinking, yeah, I'm taking charge of myself, of my body. I'm making myself strong, but also I just felt more balanced in my body. I felt I was back to normal. I wasn't being tearful. I wasn't feeling necessarily anxious the whole time. I mean, obviously, I had my periods of being anxious at certain times, especially when it was coming up to scans and checkups and things like that. But I wasn't spending my whole time worrying and feeling on the verge of tears. So I didn't really know what was going on. I was just experiencing it and very appreciative that yoga was affecting me in that way. But the more I've actually practiced yoga over the years, that physical practice of yoga, that regular physical practice of yoga, and I didn't really have a self practice until I started Aṣṭāṅga classes, and then that became my self practice, and that was something that I did. It wasn't until I had that regularity and consistency in a self practice that the other elements of yoga started coming into just, I was being absorbed basically. I hadn't done my teacher training then. I was just kept practicing and I was feeling this calmness. I loved the rhythmic breathing and the Aṣṭāṅga practice. I loved the regularity, the repetition of the sequence. So that really helped me to embody more of the yoga practice on those deeper layers of my being.
And were you doing that at home by yourself to take yourself through the Ashtanga series, or were you actually with a group of people that would do that together?
I was doing it both ways. Yeah, I'd do it twice a week at the gym, and then I would do the rest of the time, I would do self practice at home.
Wow.
Yeah. So that was really how I developed that consistency of practice. And that helped me to just feel those other benefits as well. So that was just after the Iyengar classes.
I ask a hard question of everyone. I try to. And my question for you about that, because I've never done the same postures every day for, say, a year. Like, I'll do a certain practice for maybe 6 weeks, and then I'll do another practice for 6 weeks. But
Mm.
tell me about that. Tell me about how that is to do the same postures in the same order with the same number of breaths. In some ways, you might say, wow, does that get boring? But I can imagine it could also be very comforting. Like you know exactly where you are in the
Mm.
sequence and what's coming next. Does it give a sense of control or tell me about it? I'm really fascinated.
I dip in and out of it now. I'm not so consistent in my Ashtanga practice, but I still practice yoga every day. But when I do come back to that Ashtanga practice, when I do practice it, there's nothing quite like it for me in terms of the way it makes me feel energetically at the end. I think it's the 5 breaths in each of those poses that gives you time to absorb the pose, to fully embrace it, to be in your body, to regulate your breath, to calm it if it's, elevated. Just those 5 breaths help you sort of recenter each time in each of those poses. Having the set sequence, your body knows what's coming next. So you don't necessarily have to think, oh, shall I do a half moon pose at the end of this warrior two or whatever? If you were doing, your own practice or a vinyasa style practice, the Ashtanga practice, because you know what's coming, it's your body naturally goes into it. It becomes more of a meditative practice for me. And the 5 breaths really help to consolidate it. So although I don't do it like I used to, when I do come back to it, there's nothing quite like it.
It's so interesting to me. I had a discussion the other day with someone about this that in where I study, we also have kind of set practices and a certain number of breaths with a breath count and that type of thing. And it's a completely different feeling at the end if you actually do it as it was written with the breath counts and with the number of repetitions and don't, skip anything. If you actually lay down
Mm,
and rest
mm,
in Shavasana after your standing pose, it's a completely different energetic feeling than if you kind of sloppily move through the same postures in the same order, but without the same number of breaths and just kind of like, oh, I'll skip that one today. Like, I don't know. There's something that happens,
mm.
I think, to our nervous system and our mind when your body knows what's coming next. And like you said, you're doing that number of breaths. There's a focus, I guess. Maybe it's the mental focus. What do you think?
Yeah, yeah. Yeah, I agree. I think you're very much in the zone. I mean, you've got your dṛṣṭi, you've got your breath, your ujjayi breath, and you're very much in that zone for the 90 minutes of the class.
Yeah.
It's not everyone's cup of tea, but, I don't necessarily want to do it every day, but if I'll do it once or twice a week now, and yeah.
And how do you feel at the end? Because I think sometimes we have listeners who've never actually felt that feeling that you're talking about at the end. What is the feeling for you? You can even articulate it.
Well, when I come to lie down in Shavasana, I'm certainly ready for it after that practice. And when I come out of Shavasana, I mean, it's just never ever skip Shavasana. It's so important, isn't it? When I come out of Shavasana, my body feels completely energized, but also I have this stillness as well. Stillness in my mind, more in my mind, because I'm not having to think about where I'm going to place my leg next or arm next. If I'm doing my own practice and thinking, oh, shall I do this? Shall I do that? But, it's not a huge part of my life anymore. But that's what really helped me to let the physical become more of an embodied practice
Yeah.
when I started the Aṣṭāṅga.
And now I think you do more of a kind of a flow type sequences. Is that correct?
In my own personal practice, I'll listen to my body. I'll do whatever I need on any given day. And I think I mentioned to you in my letter that since my yoga therapy training, it has really brought to light the pañcamaya kośa model.
Yeah.
And so now, instead of just getting on my mats and doing some warm ups, I will lie down on my mat or sit on my mat and go through the five koshas and ask myself, how am I feeling today physically? What does my body need physically? What does it need energy wise? How's my breathing? Where's my mind? What am I thinking? So I'm going through that kind of checklist myself just while I'm sitting or lying and deciding, what am I going to do today? How's my practice going to evolve? It's not as rigid as it used to be at all. It might just be a soft, slow flow. My flows are very slow these days. Even the flows that I teach are slow because I like control. I like to get people to feel that control within their bodies and use their muscle strength rather than the momentum of flinging a leg here and putting an arm there. I like them to actually move from their center with control. So I've really slowed down the vinyasa flow classes that I teach to make them a lot more mindful of how they're actually practicing and making transitions. That's how my teaching and self practice is going at the moment.
So this is one of the things I wanted to highlight when talking to you that at one point in your life, the Iyengar style made you feel strong and stable. And then at another time, Aṣṭāṅga gave you this feeling of focus and alertness and really challenging your body. And through yoga therapy, you're checking through the five layers of the human system and just asking yourself, what does each part of me need today? And responding. I just love how versatile yoga is and how at different
Mm.
points in our life, it can look so differently. Like this morning, my back was hurting and I didn't want to do a bunch of standing postures and push myself through that. So on this little rug behind me for 40 minutes, I just did roly-poly low back yoga.
Amazing. Yeah. Yeah.
And I did a 10-second lift into bridge pose and a 10-second lower down out of bridge pose. And you'd think, well, that's not nothing. Well, it is something. My glutes are really sore.
Absolutely.
That going that slow, lifting and lowering is actually quite challenging.
That's why I like to teach a slow flow because it is actually more challenging on the muscles, isn't it?
Yeah. I went for a walk afterwards. I'm like, woo, what was that?
Yeah, and you don't really need to do much. You don't have to have so many poses in your practice.
Yeah.
It's just doing them with integrity and with awareness and slowly with control. That's the most important thing. And that's what yoga therapy has taught me as
Yeah.
well.
And you're going to get your yoga therapy degree at Yoga Campus, is that correct?
I got it last year. I qualified last April as a yoga therapist with Yoga Campus. Yeah. I think I'm still very new to the yoga therapy world, but it's lovely to have some clients, and I work a lot with cancer clients. So that's really interesting. It's lovely to be able to support them through yoga therapy.
Yeah. So that kind of brings us to part two of your story. Are you still willing to talk about that?
Yes, yes, definitely. I know we sort of talked a lot about yoga, haven't we? I mean, it's there's so you can we can go on forever talking about yoga, can't we? I mean, it's just forever evolving in our lives. Yes, I'll let you ask the next question.
It sounds like after you went through your whole cancer journey and came out the other side and things were well in your body, your mind, your family, then it sounded like to me from your letter that you had kind of a devastating news. I don't know. I think maybe even more devastating than your own cancer diagnosis.
Mm, yes, for sure. Yeah, so in 2011, my 15-year-old son, so my middle son, was having recurrent knee pain.
Mm,
And he was away at boarding school because he's also deaf. So he was at a boarding school for deaf pupils. So I didn't see him an awful lot. He'd come home like twice a term, maybe. And so he was having this checked out with the local GP at school. And they were just putting it down to an injury, football injury, or growing pains. And then he came home for half term, and I looked at his leg and his tibia just below the knee, the medial tibia was really red and inflamed. You know, that part of his leg was really red and inflamed. And I said, look, something's going on here. I managed to get him an appointment very quickly with an orthopedic consultant during that half term week. And I remember going off, it was a really early appointment, like something like 8 o'clock in the morning, and I left the other two boys at home. My husband was at work, and I said, oh, don't worry, darlings. I'll be home to make you breakfast. You know, we'll just be in and out really quickly. Little did I know what was going to evolve that day. He did an x ray, and they discovered on the x ray that there was this huge shadow on his tibia. He said to me, well, it could be an infection, but it's more likely to be cancer. Then he referred me to another orthopedic surgeon who specializes in osteosarcoma. And that was the diagnosis that my son got. So he was diagnosed at 15 with osteosarcoma, high grade. Oh, God, it was just the whole world went upside down. I mean, it's just the most devastating news having a child, having your own child being diagnosed with cancer, and also that sort of cancer as well, because the outcomes generally aren't very good for
mm,
that cancer. So, having a child, I just wanted to put myself in his place. I just thought, like, just please, just don't let this happen to him. I don't want him to go through all of this. And I mean, it's probably a good job we didn't really know what was along the way, because if we had, you know, it would have been just even worse, you know. So you just kind of take each step at a time, just every little bit of information you just absorb, and then you go on to the next, and they don't tell you everything at once. So it involved 3 months of chemotherapy, really aggressive chemotherapy, where he had to be hospitalized for weeks, you know, for 5 days at a time, and then came out. So we stayed in hospital with him the whole time he was there. Either myself or my husband stayed in with him. And then it was limb saving surgery in the middle of chemo. Initially, they gave him a tibial replacement and a knee replacement. So they took out his knee and most of his tibia, and he was able to have an implant. But unfortunately, that implant became infected
mm.
pretty much immediately after it was put in. But he kept it in for 5 years, and then it just got so bad that he needed to have it removed and have an amputation. So that was 5 years down the line, he had amputated. But anyway, the initial surgery was to have a tibial and knee replacement, which means that you still have to learn to walk again. The physio and the rehab for that was really tough, alongside having chemo as well, you know, where your body is just really fatigued and depleted. and then another 3 months of chemo after the surgery. So it was a long, drawn out process, really aggressive treatment. And he dealt with it really well, I have to say. He did deal with it really well. He just resigned himself to it and was very accepting of it. There didn't seem to be any anger, whereas with my diagnosis, I was so angry. Alex just accepted it, accepted what was thrown at him, and just dealt with it, so well, so well. And that's really helped us as his parents because he was dealing with it so well. It enabled me to be strong as well. Whereas I think I could see him suffering, but because he was dealing with it generally quite well, if he hadn't have been dealing with it so well, it would have been even harder. So that was that. And during those 8 months, because it was 8 months of treatment, we were just juggling time with him. And the time that I had at home was just so precious to me. And that was the time where I could just get on my mat and do a breathing practice, do a few stretches, do whatever I felt I needed to do that day. And that was really such a support to me through that time.
I just want to
So,
ask, sometimes when I get very upset or anxious or worried, I have resistance to getting on the mat. It's almost like I'm so out of balance that I can't even get myself to
mm,
go do something good for me. Did you have any resistance during that time, or was it more your sanctuary that you were like, no,
mm,
it's going to feel good. I love this.
yeah, I just needed it. I didn't have any resistance. I just needed to get on the mat and just move my body. The reality of being in hospital means you don't move very much. You're sat, you're sat on a chair, really uncomfortable chair beside your child. You're sleeping on a really uncomfortable camp bed behind a curtain. And, you're hardly sleeping because you're hearing the monitors beeping all through the night. You've got other patients in the ward, being distressed or whatever. So the reality of being in hospital is that you're not moving, you're not really sleeping, you're not eating properly.
Yeah.
So just being at home, being able to have a decent meal, a comfortable bed, and my yoga practice, you just appreciate those things. I tell you, you appreciate them so much, even just to be at home to put some washing on and then to hang that washing on the washing line, stuff that you think, oh my God, I hate, that you would hate doing normally, the
Yeah.
mundane stuff. I took joy in doing that and I still do. It's changed for me now. Every
Yeah.
time I hang something on the washing line, I just think how joyful it is to be outside on a lovely day, hanging the washing up. It's just those simple things in life that actually are so meaningful when you're going through such turmoil, when you don't know what's ahead. But those routines, those things that just keep you grounded in a certain way, really just help you to get through it.
You know, as tragic as this is, I literally felt like crying when you were telling this story, just in, you know, communing with what your son must have been going through. I think it's true, though. We figure out like the very, very most simple, basic ways of being and living are really the only thing that matters. Image
Mm,
doesn't matter.
mm,
Money matters to the point that you can take care of yourself, but
mm,
excess money
mm.
doesn't matter. Prestige, fame, like none of it matters in
No,
terms of like real life and joy and being human.
absolutely. It really makes you realize what is important. And those little things just for me just helped me navigate through that time. And even the times when Alex was able to come home from hospital, so he did have a few days in between treatment where he could come home. That was just amazing when the whole family was together,
Mm.
just to be together, sitting around the table having dinner or whatever, just being at home, having him home was just the best thing. And that would restore us for a little bit. And then we'd get back into the next cycle of treatment. But all those little things in between and having things to look forward to, having, meeting up with some friends, staying the weekend with them. We had some great friends that, invited us down for the weekend and, just having those things to look forward to when you weren't in hospital, when Alex was feeling a little bit stronger in between treatments, just really kept us going and gave us a sense of normality in our family life.
Yeah. And when you were in the hospital, had you discovered the power of breathing and paying attention to your breath, and or was that after because you discovered that more so during your yoga therapy training?
I did actually, I was using breathing techniques. I definitely was using breathing techniques at the time, just sitting on the chair and just calming myself through just deep abdominal breathing, alternate nostril breathing, even times when I couldn't sleep at night, trying to sort of use some breathing techniques to help me to sleep. So, yes, I was aware of those then, and they did help for sure. Yeah. Yeah.
That's one of the areas that I think yoga therapy can be most useful is for people in acute situations in hospitals and their caretakers that are sitting there for days and days
Mm,
on end. And we've seen I mean,
yeah.
the most successful yoga therapists in the US are at children's cancer hospitals, both in Texas,
Mm.
New Jersey, and, that's where we've seen that they can make a really, really big difference.
Yes, they absolutely can. In fact, a few years later, 5 years after that, I did qualify as a yoga teacher.
Mm,
And I actually went back into the same hospital where my son was a patient. And through this charity that was supporting young people in hospital, I offered some yoga. So I went back into exactly the same ward 5 years later, which was quite tough in itself, but it was a wonderful thing to be able to do, to go back in to teach yoga to these young people and also to support their parents as well. I remember teaching one of the mothers just on her own in the playroom. We were just in the kind of playroom where they all hang out. And it was a very, very moving, humbling experience to be able to do that. And I did that quite a few times. And then lockdown happened and it all kind of stopped. But that's what gave me the wish to want to actually do more things like that. So to actually then investigate the yoga therapy side of things. And that's what led me to the yoga therapy. And I always had it in the back of my mind that I did actually want to use yoga as a therapeutic intervention to support people going through cancer. And when I originally did my 200-hour teacher training, we had to do a dissertation. And I chose to do the dissertation on yoga for lower limb amputees.
mm,
So at that time, my son had his amputation. So that was the second phase of his surgery. He had the amputation. And I was able to then support him as he was my case study for my dissertation. And I was able to support him with a yoga practice, which was just incredible to be able to do. What gave me the idea was when he was having physiotherapy, they were doing various poses with him or practices with him to strengthen his glutes or to strengthen his core. And they were doing a pose which they called Superman, which was basically Shalabhasana. I
yeah.
thought, hang on a minute, that's yoga. And I thought, and that's what gave me the idea. I was racking my brains what topic I was going to choose for this dissertation. I know what I'm going to do. This is it. And that's what inspired me to do that.
And when you taught him, how was it different than his physical therapy? Because I think a lot of physical therapists are recognizing the power of breath. And so they're kind of understanding now, like, oh, we could slow down the movement and add breath to it. Is that basically what you were doing? Were there other tools that you were also using to help support him?
Yes, it was an embodied practice. I was getting him to focus on his breathing. So we'd always start seated. He didn't have his prosthetic leg on. So he'd be sitting on a block in a cross-legged position as he could be. Beautiful tall. I would just always remember his beautiful tall spine. He had this beautiful, lovely tall spine. And he would do his breath. He'd close his eyes and he'd become present and he'd listen to his breath. And we'd always start the practice just getting inside and just taking a moment just to get into our body and into our breath. And then I take him through some seated side stretches, spinal rotations. And it was just beautiful. I mean, I've just got the most stunning photographs of him. I just remember taking them, and it was just a very special thing to do with him. And he was really receptive to it, really receptive. And it was just lovely that he was just so open to trying yoga and put him into like legs up the wall position at the end for his final relaxation. And I could see that it was really helping him. It was just helping him. He didn't talk an awful lot about how he felt mentally about all of this. But I could see that the yoga practice in itself was just giving him that stillness, giving him that peace.
Mm, I can just imagine those photographs. I mean, what a precious gift that he allowed you to take some to have such a memory of that precious time together.
Yeah, and then he came back to it again, in in lockdown. By that time, he'd left home and he was with his fiance. We'd have family yoga on Zoom. So my two adult sons would Zoom in. My other teenage son, who was still at home, would be in the yoga studio with me and my husband, and we'd all be there having our family yoga. So it was just beautiful, really lovely.
So glad you said that. I wanted to ask how Alex is now, but I thought, well, that's a little beyond the scope of this interview. But
Oh,
no,
no. Do you know, it's a really positive outcome for Alex. He's doing so well. He's actually married now and he has a little girl who's 3.5. So he
back
even
to
went
being
on to
a
have a
grandmother.
child of his own. So, look at where we've got to. There's me with my cancer worrying about seeing my children grow up. And now, well, I've got two grandchildren now. And, look at where life leads us. And I know I am one of the lucky ones, and I know my son is also one of the lucky ones. I'll always, always be grateful for that. And nothing else in the world matters more than that.
And you had this loyal companion of yoga by your side throughout all these decades to be with you, no matter how this unfolded. I mean, it sounds like it unfolded just as best as something so challenging could unfold, that it's turned out okay. But I think more importantly, the long road traveled with yoga as your constant companion through all these different things is just a beautiful, precious gift to have had.
For sure, for sure. And I may not have discovered it if it wasn't for my breast cancer.
Yeah.
And I wouldn't be where I am now doing what I'm doing if it wasn't for my breast cancer. So I feel that I'm really doing what I'm supposed to be doing in my life.
Mm.
And to be able to teach yoga and support people through yoga and yoga therapy is just such a blessing and a privilege. And yeah, yeah.
Well, I'd like to bring up your website if you're willing to kind of just talk us through the types of things that you are offering, how people might be able to get in touch with you. Um,
Thank you. When I look at it, I keep thinking, oh, I must update it sometime. It doesn't really say what I need it to say right now. But anyway.
Oh, I love a simple website, honestly. It just kind of says, here's what we do, here's how you contact us. So it's www dot.
Marcy.yoga. So the Marcy is just what my family call me. So also known as Marcy. So
Okay.
Marcy Yoga.
Marcie.
Yeah.
Marcie.yoga. Anything you'd like to tell us about any of your offerings?
Yes, I have a weekly yoga for breast cancer class, which is online. So this is to support women going through any stage of their breast cancer. So that is UK time though. So it might not be suitable for US time. I don't know. Yes, it would be the middle of the night for you. So it's 9:30 to 10:30 every Wednesday morning on Zoom. That is my group class, which can be in person or on Zoom. I also see people face to face as well for yoga therapy. And I have my regular Hatha and Vinyasa flow classes, both online, which you can check times out on my website, and also in sort of local studios in North London. So I'm based in North London. I also work with an amazing community called Get Me Back, and it's a cancer recovery community where we support through the practice of strength training and yoga and general fitness and Pilates, people helping them sort of get on their back on their feet after their cancer diagnosis. So it's for people who are through their active treatment and would like to build their strength, mobility, and improve their general well-being after cancer. And that's any cancer diagnosis. So I work with them as well.
So that's www.getmeback.uk. Do you have to live in the
Yes.
UK to take advantage of that, or can anyone join that?
Anybody can join it because all the videos are actually on demand. So you can join the live classes if it suits your timings, but all the classes there are also on demand. It's a membership. And there are times when, we get together and we talk about things, we have webinars. And Sarah, who is the founder of Get Me Back, is a cancer survivor herself. And it's a fantastic community, and I can't recommend it highly enough. So, yes, if you are abroad, you can still become a member and benefit from the practices on an on-demand basis.
Beautiful. Well, thank you for being with us today. I feel emotional from this. I don't know if anybody else listening has that little lump in their throat, but just to think of all that you and your family have been through, and it's really touching. So thank you for sharing such a vulnerable story with us.
Thank you for letting me put myself forward to to share my story and how yoga continues to support me through life. And I feel that's what it's there for. These moments, the challenges that come along the way to help us to deal with them, and the good times as well.
Yeah,
So
wonderful. Well, thank you, Marcia. It's so lovely to have gotten to know you a little bit today, and we're just really grateful that you were with us.
thank you, Amy. And I look forward to seeing you at the next SIO meeting as well, because we're on the
Yeah,
same
yeah.
special interest group, aren't we? So I might see you again there.
Wonderful. I love that group. Good.
Yeah.
Thank you, Marcia Mercier, for being with us today and for sharing yourself, your family, your story, and hope and faith to know that as we're going through these really, really hard things in life, that we can get to the other side. And Marcia and I talked after the interview for a few minutes, and she told me how well her son Alex is doing now, like all the things in his life that are so amazing and so beautiful. And he's so successful in, professional life and personal life and sporting life. And I don't know, I just wanted to end with that because I think a message of hope and faith that we can get through hard things and we can get to the other side and still have a wonderful, wonderful life. I think that's a message we all need to hear right now. It's a very challenging time, and a lot of us are feeling anxiety and depression and hopelessness and anger. I think we also need to cultivate the opposites of all of those, where we have faith, we have love, we have joy, we have kindness, we have connection. And we need to make sure that we're holding both of those in our two hands simultaneously. So go out there in the world, find some fun, some joy, some laughter. Allow yourself that time to be hopeful and to have faith that we will make it to the other side of this and you will make it to the other side. Thank you for listening, everyone. It's our pleasure to have you with us each week. Thank you to our guests this week, and thank you to all of you who are listeners of the Yoga Therapy Hour. I'm not sure if you know, but I've had a life change in the last year. I'm now the chair of yoga therapy and Ayurveda at Maryland University of Integrative Health. We are having some changes there. In the fall of 2025, we expect that a full merger will have happened with Notre Dame of Maryland University, and we will become a graduate school at Notre Dame of Maryland University. We're going to be called the School of Integrative Health. If you're interested in a master's degree in yoga therapy, we'd love to talk to you. Or if you're interested in a post-master's certificate, meaning you have a master's in some other area, but you would like to now come and study therapeutic yoga, we would also love to have a chance to show you our program. We also have certificate programs in Ayurveda. So if you're interested, just come to www.theoptimalstate.com and find me, or you can look us up at Notre Dame of Maryland University. Until the merger happens, we'll still be over at www.muih.edu. Thank you for listening. We look forward to seeing you next week. Thank you for listening to the Yoga Therapy Hour. We wish you a wonderful week. We hope that somehow, in a small way, we've contributed to your well-being so that you can go out and share that well-being with others. That's what life is all about, bringing in the goodness through you and then shining it out to the world. We need you more than ever. So let's all get out there, do good, be good, and have a great week.